G'day team, it's Chris speaking. Welcome or welcome back. Today we are talking about a more serious topic within the transmasculine community, and that is testosterone and pregnancy. So just a content warning very quickly, if you're uncomfortable with talking about pregnancy and transition, probably a good idea to click away. I am going to be talking about pregnancy specifically within the transmasculine community, and if that's something that you don't really want to know about, then click off. If you want to know about it later, but you're not ready to do so, then just bookmark it and you can come back to it when you're in a better mental state. If it's not for you, click away. The reason that I want to talk about testosterone and pregnancy is because I'm seeing a lot of questions, particularly by young transmasculine people, being asked in the Australia transgender groups on Facebook. Can I get pregnant? What happens if I get pregnant? What do I do to stop pregnancy? Is it possible that a pregnancy test will not show a positive result because I'm on testosterone? And I'm here to, discuss those aspects of our lives. It can be very scary for transmasculine people who are on testosterone and are presenting masculine but are intimate with cisgendered men or even trans women who are pre-op bottom surgery, and it's a difficult topic to navigate even with doctors. Even if your doctor is cool with being trans, it's sometimes quite dysphoria inducing to ask those questions of your medical professionals. Unfortunately, they are the best people to talk to. Your medical professionals, particularly the ones that prescribe you hormones, are going to know all those effects. Definitely be talking to them. There are a lot of trans men who do get pregnant, and that is their choice. That is something that they want to do, but they do go and see fertility doctors and just basically medical staff who can help them along the way. So first and foremost, if you are on testosterone and you are having sex with a penis, then yes, you can get pregnant if you're not using protection. It's very, very possible. Testosterone does not mean that you're immune to pregnancy. It is not a contraception. You are still able to fall pregnant if you're having sex with a man without protection, a cis penis without protection. So be very wary of that. There are a couple of options for you in terms of birth control. The first one being condoms. I think they're still like 99% effective. If you're having sex with a cis penis, then condoms are a good way to go. I understand that there are arguments for condoms not being comfortable and whatever, but if you don't want to get pregnant, wrap it up. Also protects you against sexually transmitted diseases, and that's the first thing a doctor is going to ask you, is if you're being safe. If you don't like the condom route, there are other ways to... I'm sorry, there's a fly buzzing around. It's been here all day. It lives here. There are other ways to protect yourself from pregnancy if that is not something that you want to happen. That is not the pull-out method. Don't use the pull-out method. Guys, not safe. Don't do it. Do what you want. I'm not your parent, but don't do that. There are two things that I talked to my doctor about it just because I was curious and I was seeing these questions pop up, so I wanted the answers to give to you guys. There are two birth control options for transmasculine people who are hormones in Australia. So I am from Australia, I can't speak for other countries. There is a pill without the hormone component in it. Still not recommended from my doctor anyway to go down that route. The two that she mentioned was the Mirena and the bar, the Implant. I actually got one. I picked one up to show you guys what it looks like. I haven't opened the box or anything like that. The Mirena is an internal insertion, so she did warn about dysphoria with people, but it goes inside basically blocks the cervix, I believe. I don't know too much about it, but it is internal. It's basically a day surgery, or it's a surgery of some kind. Whether you just leave after it's in there can be quite uncomfortable. I've personally heard horror stories from women in my life who have been on the Mirena in terms of weight gain, of bleeding, and just overall not overly pleasant symptoms that have come from it. So if I was going to go on something like birth control, not going down that route personally. You may be on it and you're fine. Remember that everyone's body is different. They're going to react to things differently, and you might be completely fine. The one that I asked my doctor about to explain a little bit more on is the bar. So Implantron, or whatever it's called, the Entogestral implant for subcutaneous use. I hope I pronounced all those things right. What this is, it's a little plastic rod. It's about this long, so it's quite long. and it goes inside of your non-dominant arm. So it goes inside the bicep, they make a little incision, they pop it inside. It can be done as whenever you go into your doctor, they can do it for you then and there, and you can go home and you're sweet. It basically works like the pill in terms of how long you need to wait before you can have unprotected sex and still be protected. And so I think it said 2 weeks to be safe, but generally I think that's the same as the pill. It's been a long time since I've talked or been on the pill, but I think it's about the same time frame, about 2 weeks for it to come into effect. Now, she did warn that you can have some bleeding on this as your body gets used to it. So just be very wary that you may get some downstairs bleeding, and if you don't want that, then that's we can't choose what our bodies do, unfortunately, but it can be quite dysphoria inducing. So if you are with a partner, make sure they know that it could happen if you're going to go down this route, just so that they can support you through that. The other question that I see a lot is, will testosterone affect a pregnancy test? So your take-home pregnancy tests that you get from your supermarkets or your drugstores or wherever that you get them, wherever you are in the world, the answer is no. So the hormone that is produced once you are pregnant is going to be produced regardless of whether you're on testosterone or not. I think it's HCG. I can't pronounce it, so I'm not going to try. I will pop the name of it down on the screen below. But basically, once you are pregnant, that hormone will be in your body regardless of whether you're on testosterone or not. So your take-home pregnancy test is going to show a positive or negative result dependent on whether you're pregnant. Now, I've seen false positives before. I've seen negative negatives. Is that even a thing? I mean, I would always recommend to do it twice, but maybe that's just my brain. But if you get a positive result, maybe check the next day or the next week. If it does turn up to be positive, go and see your doctor, particularly if it is not something that you can handle in your body. It's important to make that doctor's appointment very, very quickly. But in terms of will it read positive or negative, if that hormone is in your body, it's going to read as positive. So get it checked out. That's my experience with births. That's my experience with birth control as a transmasculine human. Be very wary that testosterone is not birth control. There are other methods of birth control that you can go through, and your pregnancy test will read positive if you are pregnant, regardless of whether you're on testosterone. And if that's the case, see your doctor. Always check with a medical professional for anything related to your body, particularly if you're transgender. I know it can be hard to talk about, but very important to do so. Alright guys, that's it from me. If you like the content, give it a thumbs up. If you want to see more of it, then click on my face down below. If you want me to ask my doctor things for you because you're not comfortable in doing so, I see her every 3 months for my injection. I'm happy to do that for you. Just send me an Instagram DM. If you're not comfortable leaving a comment, that's fine. I'll catch you next time. Okay, bye.